Hey, my name is Deep Singh. I'm washing my hands. All right. I'm going to be doing a physical assessment on my client today. Hey, how are you doing today?
Good.
Can you tell me your name, where you are, and the date today?
Denise, at home, April 29th, 2022.
Patient learner oriented. From this, we can tell the patient's speech is clear. We're going to take the vital signs. Sorry, we got the blood pressure cuff on. The nurse put it on last time.
Yep, it's gone.
Okay. I will manually check for her respirations now and count them. Okay, so 126/78. Heart rate is at 80. Respirations I counted was about 16 in a minute or so. 16. We're gonna actually check for the patient's pulse deficit too, if she has any. We'll be doing that with the radial artery over here, and we'll also be checking for the patient's PMI, which is the apical pulse. So let's do that. That's going to be at the left mid-clavicular, fifth intercostal space. Okay, I don't see a difference in there, so that's a positive. A normal finding. So let's test for the patient's remote memory. Do you know who the first president was?
George Washington.
Do you know who the current president is?
Joe Biden.
We'll also assess for the patient's spelling. Can you spell water?
Water.
Okay, patient's memory, speech, cognition seems to be all intact. So those are great findings. She is breathing normally. Let's move on to the head. The head from on inspection, you can see it's non-traumatic, normal cephalic. I don't see any masses or lesions or scales on her head. So next we'll palpate the head for any tenderness, masses, no nodules or anything like that. Do you feel any pain over there?
Okay.
Oh, sorry, I messed up your hair a little bit.
That's fine.
So the hair texture, we're going to take a look at the hair. The hair texture is coarse. I don't see any alopecia. It's evenly distributed. So next we'll move on to the face. Can you look up? All right, the face is symmetrical. I don't see any breakage in the skin. No lesions. No acne either. All right, so we'll just gonna palpate the temporal arteries. Those are +2 pounding, so those are more findings. I'm gonna palpate for the frontal and maxillary sinuses. Those are normal, so that's good. Next, we'll assess for symmetry in the patient's face, facial muscle group. So that's being done by the, we'll do test for cranial nerve number 7, which is a facial nerve. So on my command, I want you to raise your eyebrows, close your eyes. All right, I'm going to apply some resistance on your eyelids. You're going to try to open them. Very good. So that's normal. I want you to smile, frown, and puff out your cheeks. Good. So facial nerve muscles are intact. All right. So now we'll check for the trigeminal nerve, which is cranial nerve number 5, which has 2 parts to it. We have the sensory and the motor function. We'll check out the motor function first. With your teeth, you're going to bite down, and I'm going to feel for your masseter muscles. Okay, and your temporal ones. Okay, those are normal findings. Next, we'll assess for the sensory portion. So I have the a sharp object and a not so sharp object. I would say a sharp object. All right, so we're going to test the forehead. Forehead.
Soft.
Oh, you're closing your eyes, right?
Yep, okay. Eyes are closed. Soft. Sharp.
Okay.
Soft. Sharp.
So we tested for sensation in the cheeks, in the masseter muscles, or mandibular, in the forehead. Okay, so that is all done. Now let's assess for the lymph nodes. We'll start with the preauricular ones. Let me know. I'm going to palpate. You're going to tell me if there's any areas of tenderness.
No pain.
Preauricular, postauricular, occipital, tonsillar, submandibular, mandibular, and submental. Any pain?
No pain.
Now we'll do the superficial cervical chain. Any pain?
No.
We're going to turn that way. And deep cervical chain.
No pain.
And we'll do the posterior cervical chain. Any pain?
No pain.
And we'll have supraclavicular. We'll do that too.
No pain.
Okay. So now we'll jump on to the eyes. The eyes, the patient's eyebrows, you can see they are symmetric. They are in place. There's no loss of hair. So that's good. No fungus growth or anything like that. No lesions presented over there. The eyelids are not droopy. They're not swollen. They're not red either. There's no breakage in the skin over there. The iris is brown. The cornea is translucent. The eyes are about 3 millimeters in place, bilaterally symmetrical. I'm going to palpate for the lacrimal gland and your inner medial and lateral canthus.
Mm-hmm.
Tell me if you feel any pain.
No.
So from there was no pain there. There's no exudate coming out. There's no discharge coming out. Those are all normal findings. All right, so next we'll look at the patient's conjunctiva. It's pink bilaterally, so that's normal. The sclera is pink and non-traumatic. So now we're going to look into the patient's eye a little bit closer with the fundoscope. Okay. I'm going to look straight ahead. I'm going to push this way. Okay, so red eye reflux is there. I didn't find any opacities. Retinal vessels are intact. The macrophovia are visible. Cup to disc ratio is about 0.3, and disc margins are sharp. Let me see this on this side. Okay, so red eye reflux is there. Same thing. I didn't find any opacity. The retinal vessels are intact. Didn't see any. The disc margins are sharp. Didn't see anything abnormal in there. Basically, it's the same thing as the right eye. All right, so now we'll test for cranial nerves number 2, which is your optic nerve. We'll test for visual acuity and confrontation. So I have the Snellen handheld chart here. You're gonna place this at the arm's distance, and you're gonna read the lowest, the smallest letters.
LTFPH.
Cover one of your eyes and do it.
LTFPH.
Cover the other eye and do it.
LTFPH.
So visual acuity 20/20 on this. You don't need glasses or anything like that. All right, so now we'll test for the confrontation test for her peripheral vision. I'm gonna come across you. You're gonna tell me when you start seeing my fingers.
Now.
Okay.
Now.
Okay. Patient's peripheral vision is intact. Now we'll jump straight to the cranial nerves numbers 3, 4, and 6, which is your oculomotor, trochlear, and abducens. We are gonna test for the 6 cardinal fields of gaze. We're gonna test for the direct consensual light reflux, and we are going to test for convergence and accommodation. Okay, so let's do the light reflux first. I'm going to shine a light in your eye. You look straight. Okay, pupil constricts. All right, the opposite eye, the pupil constricted too. Now this eye. Okay, pupil constricts. All right, pupil constricted too. The other eye. So sorry, I know it's a little glaring. All right. Next, we'll do the 6 cardinal fields of gaze to see if the patient has any nystagmus and assess for her oculomotor eye muscles. You're gonna follow my finger with your eyes. Okay, so no eye twitching on that, so that's really good. That's intact, and we're also going to test for accommodation and then convergence. Convergence, accommodation. Convergence, the eyes narrowing in, so those are all positive findings. All right, so the patient does have perla, pupils equal to light and reflex.
Okay.
Pupils equally to light and accommodation reflex. All right. Let's go on to the nose.
You're good. Keep going.
Yeah, people. The nose is symmetrical. I don't see any lesions or anything like that. Just getting a little nervous. Nose is symmetrical. I don't see any lesions. No breakage in the skin. Okay. Gonna palpate the nose for any tenderness.
No tenderness, no pain.
Okay, so we're gonna take a look inside the nose. Sorry. Okay, so in the nose, ears. It's good. It's good. Sorry, I know it's not a great feeling.
You're good.
All right. So what my findings were: nasal turbinate or patent. There's no nasal polyps. Nasal mucosa is pink. I didn't see any septal deviation in both nares, and there's no discharge, scarring, or unidentified objects in the nose. So that's good. We're also going to test for the cranial nerve number 1, which is the olfactory nerve. That is, we are going to present a candle, and she's going to tell me what she smells.
Vanilla.
She said vanilla, and she passes the test. We're also going to test for patient's patency of the nares. So I want you to occlude one nair and breathe. Occlude. Okay, so she's breathing, and she was able to do that. So the nose is normal findings. Next, we'll move on to the ear. The ear on inspection are equally set. I don't see any breakage in the ear integrity skin. No lesions, no nodules, none of that sort, no redness either. Okay, so I'm going to palpate for the tragus and the mastoid. Any pain there?
No.
Okay, so we're going to take a look inside the ear. Okay, so this is normal. Okay, so normal. So my findings for the ears on the left side, we have the corona light at 7 o'clock. Tympanic membrane is pearly and gray. I didn't find any discharges. These malleus and the pars faceta are intact. There is serum in there. That's a normal finding. But I didn't see any scarring or masses or lesions, like I said, in both of the ears. On the right side, corona light was at 5 o'clock about. Tympanic membrane was the intake, intact, pearly and gray. Pars faceta was visible. No scarring, no perforation, none of that sort. No unidentifiable objects in the ears. Okay, so next we will test for your hearing, and we're going to test for the acoustic nerve, which is cranial nerve number 8. Cranial nerve number 8, we'll be testing with that with the tuning fork. So I'm going to strike this tuning fork. You're going to let me know if you hear the noise on equally on both of your ears, okay?
Equal in both.
Okay, so now that's a normal finding. That was the Weber test. Now we'll do the Ryan test. I'm gonna strike the tuning fork, place it on the mastoid, and then level it to her side of the ear and seeing where she hears it more. All right.
Now.
Okay. Now what about this side?
Now.
Okay. So those are normal findings. Hair conduction is greater than bone conduction. Now we'll do the gross whisper test. I'm going to occlude one of your ears, and I'm going to whisper something. You're going to tell me what I whispered.
1, 2, 3.
Okay, very good. Same thing on this side. I'm going to whisper something.
1, 2, 3.
So patient's hearing is intact. We'll jump on to the mouth next. With the mouth, we're going to start with the lips. The lips are pink and moist. I don't see any breakage or sores on the lips. Gonna get my light. Gonna take a look. Say ah. Okay, tongue is not swollen, pink and moist. Under the tongue is pink and moist. The gums are not receding or anything like that. The teeth are intact. No, I don't see any cavities. The buccal mucosa is also intact. No white patches on the buccal mucosa. no skin integrity is not compromised in the buccal mucosa. There's no tears or anything like that. The soft and hard palate are there. They're pink and moist. The tonsils were +2 without any exudate, and they were pink and moist also. Okay. So now we'll assess for the patient's cranial nerves numbers 9 and 10, which are your glossopharyngeal and vagus nerve. So we'll assess for the patient's swallowing and the gag reflex. Okay. So I want you to drink some water and say your name.
Denise.
Okay. So there's no hoarseness in the patient's voice when doing that, so that's good. We'll assess for gag reflex. All right. So she gagged. So that's that the cranial nerves of 9 and 10 are intact. We'll also assess for the patient's cranial nerve number 12, which is the hypoglossal nerve. So I want you to stick your tongue out, put it to the roof of your mouth, close your mouth, put it to the side of your cheek, put it to the other side. I'm going to apply some resistance now, and you can do the same thing. Okay, so muscle strength is there. The patient is able to move her tongue. So that's intact. Now, I will do the cranial nerve number 11, which is the spinal accessory nerve. When I apply some resistance, you're going to shrug up. Okay. Maybe my hands are cold, she shrugged up a little bit too sooner. All right, so that's done. Let's go to the neck. Patient's neck is on visual inspection. I don't see any masses, no lesions. Skin integrity is not compromised. All right. So now I'm going to palpate the neck. Any pain?
No.
Tenderness?
No.
Okay, so trachea seems to be midline. She did not feel any pain or anything like that. There's no visible pulsations at the neck. Now I'm going to give you a cup of water, and we're going to check for the thyroid. All right, wait, don't drink yet. Okay, you're going to turn right? Okay. Any difficulties with that?
No.
All right, perfect. So now we'll go to the patient's chest. From her sitting in the way she is in an upright position, you can see that she's breathing effortlessly. I don't see any bulging or retractions while she's breathing, no accessory muscle use, so that's a really good sign so far. The chest is symmetrical. I don't see any, on inspection, I don't see any lesions, no nodules, no masses are present, no breakage in the skin. It's not red either. So I'm going to check for the patient's symmetry while she breathes. Okay, this is done using the 2 thumbs. Now we'll do the back side. Okay, so that's good too. So those are all normal findings. We're going to palpate the chest next. Let me know if you feel any areas of tenderness.
No pain, no tenderness.
No pain, no tenderness here?
Mm-hmm.
Okay, so that's a good sign. We're also going to percuss next.
All right.
So all areas are resonant. So those are normal findings. Use my stethoscope to auscultate for lung sounds. Breathe. Take a breath. 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 Lung sounds were all clear. Patient took very deep breaths. Okay, so we have bronchiovesicular towards the inner lobes and near the sternum area. So those are positive findings. And we have vesicular towards the outer lobes. All right, so now we'll go to the back. Back on inspection is symmetrical. Scapula is symmetrical too. I don't see any breakage of the skin. I don't see any lesions either. So now I'm just going to palpate the back.
No pain so far.
No pain?
No pain.
Okay. Sorry. No pain. That's good. We're going to percuss the back. All right, so that's good. Now we will auscultate the back. Take a deep breath in. 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 Breathe in. Breathe in. Breathe in. Breathe in. Breathe in. Breathe in. Okay, so breath sounds are all equal, and breath sounds are all equal with bronchivesicular towards the spine and vesicular towards the outside. I'm just going to take a look right here. AP to lat diameter is about 0.7 centimeters, so that's good. We're going to check for the diaphragmatic excursion. I'm going to start right here. I want you to take a breath in. Hold. Okay, let it out. And we're going to go back up. Okay, so that area is about 4 centimeters, which is a normal finding. All right, so now we'll check for areas of consolidation. I'm gonna listen. When I place my stethoscope on your back, you're gonna say E. We're gonna check for egophony now.
E, 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 E.
Clear E was heard, which is a normal finding. Now we'll check for the whispered pectoralique. I'm gonna whisper. You're gonna whisper 1, 2, 3, and let's see if I can hear it. Okay, so the sound was muffled, which is a normal finding. Finally, we'll do the tactile phrenitis. When I palpate your back, you're going to just say 99.
99, 99, 99.
Okay, so all normal findings so far, which are really good. So there's no consolidation. Next, we'll look at the chest and identify our four landmarks. We have the aortic, pulmonic, we have tricuspid and mitral. So aortic is going to lie on the right mid-sternal second intercostal space. The pulmonic is going to lie on the left sternal border, second intercostal space. The tricuspid is going to lie on the left sternal border to the fifth intercostal space, fourth or fifth intercostal space, and the mitral is at the midclavicular line all the way to the fifth intercostal space. So we're going to take a listen to that with the diaphragm first. All S1, S2 sounds. Now we'll take a listen using the bell.
You're fair.
Okay, so no murmurs, no bruise heard, all that. Let's sit over here. You're going to lean forward a little bit, and I'm going to do the same thing. I'm going to listen for hard sounds when the patient is leaning over. Aortic, pulmonic, tricuspid, and mitral. All S1, S2 sounds heard. We will also listen for any murmurs or bruise. And this is with the patient leaning over. No murmurs or bruise heard. Now we want the patient to lay down in a 30-degree angle, and we'll do the same thing. Okay, now we'll listen with the bell. All S1, S2 sounds heard. Alright, so all S1, S2 sounds heard with the bell too. I mean, no murmurs or no bruise with the bell too. I'm gonna check for the JVD angle. Now I'm gonna take a centimeter reading card. So we want to identify the sternal notch, which is right here. Have the patient turn to her left so we can assess the right side. Typically, we want this to be 4 to 5 centimeters. So we get the top of the internal jugular, and we make an angle to where this meets, and it's about 3.5 centimeters, which is a normal finding. So I'm going to put this back. I'm also going to palpate the carotid one at a time, +2, and we'll check with the we'll check with the bell for any murmurs. So that's normal, all normal findings. So now we're going to palpate for the heaves and the thrills. Any heaves?
No.
I mean, sorry, no heaves. I didn't feel any heaves or thrills. That was a yeah. All right, let's go to the next. You can set up. Oh, abdomen. We're doing abdomen. Sorry, you can lay down. I'm sorry. We're doing abdomen. All right. So on inspection, abdomen is it's not rounded. I would say it's more flat. We do have no scarring is there. The navel belly is it's there where it's supposed to be. There's no cuts in the skin. There's no masses. I don't see the aorta pulsating, abdominal or aorta pulsating either. All right, so now I'm going to listen to bowel sounds using the diaphragm. Starting with the right lower quadrant, going up to the right upper quadrant, normal, going to the left upper quadrant, now going to the left lower quadrant. Normal active bowel sounds are heard. I heard about 12 or 12 to 13, even 15, 16 in the left side. All right, so now we're gonna percuss the abdomen. So all areas are tympani. Okay, so now we're gonna palpate. Let me know if you feel any tenderness.
No tenderness, no pain.
Okay. Now we're gonna do a deep palpation.
No tenderness, no pain.
Okay, so very good. So now we'll try to locate the liver and palpate for the liver, and that's on the right upper quadrant. The liver is palpable with edges being smooth. I don't see it being too big. Next, we'll percuss for the liver. So the liver, you're going to follow the right midclavicular line, right below the nipple line. And you're going to assess for areas of resonance to dull. So right about here. Next, you want to mark that area, and you want to start from the navel of the same quadrant, same side, the right side, and work your way up. And you're going to change. You're going to notice the change from tympani to dull. So that was like right here, and that area is about 6 centimeters. All right, so now we'll take a look at the spleen. We're going to try to palpate for the spleen. The spleen is not palpable. If it's over large, it might be palpable. So, and next we will try to percuss that area. All areas of tympani over there. So that's a normal finding. So I want you to sit up now. And we're going to assess for the CVA tenderness, all right? So we're gonna do this. We're gonna find one area, the flank area, and punch it.
No pain.
No pain, not punch it, but punch your hand.
No pain.
If the patient did have pain, that would be a marker for some kind of kidney injury or disease. Okay, so the abdomen. Next, we're going to take a look at the patient's skin. Patient's skin is appropriate to ethnicity. It's warm to touch. I don't see, there's no cyanosis in the foot, they're on the hands. There's no open lesions. Skin integrity is not compromised. Skin is intact. I don't see any moles or nevus or any of that sort. We're going to take a look at the patient's capillary refill in each finger. It's 0.3, less than 3 seconds. In the toes, about the same, less than 3 seconds. We'll assess for skin turgor. Skin does not tent, so that is good. And we'll check for clubbing. I want you to take your fingers and place them like this. And I want to see one by one. Yeah. So there is no clubbing, and patient, there's no indurations or edema either. Okay, so next, what do we have? We will do the pulses, since we're at this already. So we have the brachial pulse here, +2 bounding. Brachial pulse here, +2 bounding. Radial pulse here, +2 bounding. Radial pulse here, +2 bounding. Dorsalis pedis, +2 bounding. Dorsalis pedis, +2 bounding. Posterior tibial, +2 bounding. And raise this leg, yeah, and that's +2 bounding. All right, so next we're gonna take a look at the spine. So I want you to actually stand up now. Okay. All right, so we got the spine. We want to take a look at the patient's curvature. I don't see any curvature. The patient is standing upright and tall. She has good balance. She's able to stand on her feet. So we're going to start with the neck actually. I want you to look down, look up, look to the side, look to the side. Any pain? All right, I want you to resist my hand when turning. Very good. All right, so now we're going to bend over and assess the spine from the back. All right, any pain here? No? Okay, so you can come back up. So I don't see any lordosis, kyphosis, or scoliosis. Patient has a normal curvature in her spine. We're also going to actually, I'm going to palpate the muscles close to her spine. Any tenderness?
No.
We're going to palpate the muscles that are a little bit further out than the spine, the paraspinal muscles. Any pain?
No.
Okay, so that's good. I want you to turn around. Okay, so now I want you to, we're going to test the patient's jaw. All right, so test the patient's jaw. I want you to move your jaw side to side in a circular motion and bring your jaw out. Any tenderness?
No.
Okay. Let's also test the strength of your jaw. Push it against. Okay, good. So jaw strength is good. Any issues with biting or anything like that? No. Okay. All right, so now we're going to go into the, we're going to take a look at the patient's rest of her joints and muscles. So we have I'm going to palpate the areas that we're going to focus on. The shoulders. I'm going to palpate the shoulders. Any pain?
No.
How about the elbows? Any pain?
No.
Okay. What about the wrists?
No.
What about the metacarpals?
No.
No. What about the distal metacarpals? The proximal metacarpals?
No.
The hips? Any pain?
No.
The knees? Any pain?
No.
The foot? Any pain?
No.
Ankles?
No.
And the toes?
No.
So patient does not have any pain in any of those areas. Next, we'll assess for range of motion. All right. For the shoulders, I want you to extend your arms this way. Bring them forward. Bring them up. Any pain?
No.
I want you to bring them back. Very good. Any pain? Okay, so patient has full range of motion in her hands. Shoulders. Next, we'll assess the elbow. Let's bend the elbows. Any pain?
Nope.
Okay, so that's good. Let's do the wrist. Go up and down. All right, that's good. And the fingers, you're gonna open and close. Very good. The hip. Let's assess the hip range of motion.
Mm-hmm.
So I want you to let's move this chair out the way. Want you to abduct the right. Bring it back. Yeah, that's good. I want you to flex the hip and extend. Flex and hip. Yeah, extend. That's good. Do the same thing on the other side. Abduct, adduct. All right, very good. So that's good. What about the knee? Can you bend your knee and extend your knee? Very good. Let's do the ankle. I want you to turn it side to side. And eversion, bring it in and outside. And bring it up and down. The same with the other foot too. Very good. Now we'll do the toes. Just bring them up and down. Okay, very good. So patient has a range of motion in all aspects that were assessed. Now we'll take a look at the patient's strength. So I'm going to apply some resistance while she does some range of motion exercises. You're going to bring your arms to the side. And I'm going to actually be behind you. And we'll apply some resistance. All right. Try to bring it up. Good. Try to bring my hands down. Okay. Very good. Now let's do the elbow. Try to curl. Okay. Curl. Good. Now let's do the wrist actually. I'm going to push my, basically push me. Okay. And now you're going to pull me. Okay. So that's good. What about the fingers? You're going to make a little, like half a fist, and try to open, I'm going to resist with my hand, you're going to open your hand. Okay, so that's good. The hip, we're going to do the same thing. You're going to try to maintain your balance. I'll be here for you. You're going to extend, abduct your left leg while I apply resistance. That's good. Good. Okay. So that's good. The knees. We're going to do the same thing. You're going to sit down. Apply resistance. That's also the quads. Let's go to the back, the hamstrings. All right, that's good. The foot, you're gonna push down like you're on a gas pedal. Push down. Very good. And you're going to push up. Okay, wow, heard that correct. Push up. I push down on gas pedal, and now you're going to push up. The toes, same thing. Okay, toes, same thing. All right, so motor strength and muscle strength is good. She's got a 5 out of 5 in all places that were assessed. Next, we'll do the tone. We'll assess the patient's muscle tone. So we have the, don't just let me do it. You're not gonna apply any energy doing this. Going up, it's down, up. Good tone, no flaccidity there. We're gonna do this side. Okay. Okay. Let's go back on the bed real quick. So we're gonna do the knee. Okay. The knee. Okay, we'll do the hip. Okay, we'll do the hip, in and out. All right, very good. You come back. Now we'll do the deep tendon reflexes. So the tone was actually pretty good. I didn't see any flaccidity there. So we'll do the deep tendon reflexes next. I got the hammer. So we'll do the biceps tendon first. Let's just rest on my arm. Okay, good. We'll do the biceps tendon this way. Okay, good. We'll do the triceps. Okay, we'll do the triceps. We'll do the brachioradialis. Sorry. Okay. Find that rope feeling. All right, that's good. We'll do the patellar. Relax. Okay. Okay, we'll do the Achilles. Yes. Okay. All right, so tendon reflexes are there, so that's a normal finding. We're actually going to do the Babinski test too. So you're going to hold your feet up, and we're going to look for that inward inward toe curvature. So that's normal here. Okay, so that's normal there too. All right, so next we'll do the sensory part. So the patient will experience sensations from sharp, pain, dull, and vibratory. So let's do, so you're gonna close your eyes, you're gonna tell me what you feel.
Mm-hmm. Sharp, 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 sharp.
Okay, so she was able to feel sharp. So let's do
Dull, 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 dull.
okay. So she was able to feel dull. So vibratory. Oops. Let's pretend she didn't hear that.
Vibratory, vibration, vibration, vibration.
So she felt the vibrations. Next, tell me what you feel.
Pinching, pinching.
Okay, so she was able to hear all of that. And next, we're going to test for stereognosis. I'm going to place an object in the patient's hand. She's going to tell me what it is. Close your eyes.
A pen.
Okay, so she was able to identify that. That is great. Next, we'll test for the patient's balance. All right, so first we're going to test the hand-to-nose coordination test. You're going to place your finger on your nose, and you're going to follow and touch my finger, and put your finger back. All right, good. So now we'll do the pronator drift test. She's going to have her hands out, and she's going to put the legs together, and she's going to maintain that position for about 15 seconds or so. So there's no pronator drift here, so that is good. Now we'll do the Romberg test. The patient will close with their eyes closed, and let's see if she shifts and hands to the sides for about 15 seconds. All right, so she passed that test too. Very good. Now I want you to let's see your gait. Patient is actually standing up, upright, good posture, and let's assess her gait. You're gonna walk straight as you normally would. Now you're gonna do a heel to shin test. Yeah, just like that. Yep. No, not heel. You're gonna walk heel with your heel. I mean heel to toe. I'm sorry, heel to toe. Yep. And then we will walk on your toes. So there's no loss of balance there. And we're going to walk on the balls of your feet. So finally, we'll do the heel to shin test. Hold on. So you're going to put your left foot heel on your right foot shin and put it down. Okay, the other one. Very good. So patient was able to do all of that and without any complications. And that concludes our assessment today.